Define and classify medical negligence with suitable examples. What precautions should a doctor take to prevent a charge of medical negligence against him or her? Medical professional negligence is omission to do something which a reasonably competent medical practitioner, guided by prevailing standard of medical knowledge and practice, act of omission, and such other consideration which ordinarily which regulate the conduct of a medical man, would do or do something which such as a reasonably competent medical man would not do, leading to some harm and damage to patient. Act of commission. So act of omission and act of commission. Medical professional negligence is omission to do something which a reasonably competent medical practitioner, guided by a prevailing standard of medical knowledge and practice, and such other consideration which ordinarily which regulate conduct of a medical man, to do or do something which such a reasonably competent medical man which not do, leading to some harm or damage to patient. 4 D's. Duty to patient. Duty to patient. For charge of negligence, doctor should be duty bound to attend a patient regularly. However, this does not apply in emergency situation or when a doctor refuses to attend a patient on a valid ground and establish a doctor-patient relationship. Next is dereliction of duty, means a failure of doctor to perform his duty as expected from a competent doctor in an established doctor-patient relationship. However, inability to cure disease or prolonged suffering does not mean dereliction of duty. Damage foreseen. Actual damage or harm should result in patient due to dereliction of duty. Amount of damage determine liability of doctor can be in form of loss of earning either due to enforced absence from work or prevention or reduction of this ability to pursue his occupation. Expenses incurred. Reduction in life expectancy. Reduced enjoyment of life. Pain and suffering, either physical or mental. Loss of potency, death, criminal negligence. Direct causation. There should be direct causal connection between dereliction of duty and damage resulting. Classification. Civil negligence and criminal negligence. Act of negligence on part of doctor which causes suffering, some suffering, harm or damage to patient, which can be compensated by paying money and does not come under purview of CRPC and IPC and does not demand legal punishment for doctor. Scenario. When a patient or his relative brings a suit in a civil court for a realization of compensation from his doctor if he suffered injury due to negligence. When a doctor brings a civil suit for realization of his fees from the patient or his relative who refuses to pay, alleging professional negligence. Examples: failure to obtain the informed consent, failure to examine patient himself, failure to delay or in diagnosis. Criminal negligence. Kind of negligence where a gross lack of competency, gross inattention, gross negligence in selection and application of remedies, or utter disregard for life and safety of patient result in death of patient. More serious than civil negligence. Criminal negligence is practically limited to cases where patient dies. Criminal negligence is punishable under section 304A IPC for imprisonment up to 2 years. Scenario: when a doctor gross absence of care and skills result in death of patients or serious injury to him. Civil negligence and criminal negligence. Failure to attend the patient in time or altogether, making wrong diagnosis due to absence of skill and care, failure to provide a substitute during his absence, failure to immunize and to perform sensitivity tests when indicated, to delegate his duty or of treating or operating upon a patient to another doctor without consent of his patient, failure to give proper instructions, failure to give a proper post-operative care, failure to keep abreast of advances in medical sciences, failure to warn patient of side effects, failure to obtain consultation where appropriate, experimenting on patient without consent, giving overdoses or giving poisonous medicines carelessly if his negligence gets others infected from his patient, negligent management of procedure, continuing practice regardless of several warnings, iatrogenic medical complication during diagnosis or treatment, not ordering X-ray where a history is suggestive of fracture or dislocation of foreign body in the wound, not reading X-ray film correctly or in failing to get it read by a competent person, discharging patient prematurely. Criminal negligence, when a doctor performs an illegal act. When an assaulted person dies, death may be attributed to negligence of doctor by defense lawyer. Examples: amputation or wrong finger or operation or wrong limb or wrong patient, leaving instruments, tubes, sponges or swabs in abdomen, administration of a wrong substance into eye causing loss of vision, performing criminal abortion, gross mismanagement of delivery of woman, especially by a doctor under the influence of drinks or drugs, grossly incompetent administration of general anesthetic by a doctor addicted to inhalation of anesthetic. Precautions and defenses against medical negligences. Precautions: avoid overconfident prognosis and promising too much to patient. Before injecting or using a drug should be properly identified. Consent: obtained informed consent of patient. Obtain a consent for an operation or giving anesthesia to use discretion in obscure cases. Obtain consent of patient before adopting any experimental method. Do not criticize or condemn personal ability of another doctor, especially in presence of patient. Employ ordinarily skill and care at all times. Employ ordinary skill and care at all times. Female patient should be examined in the presence of a third party, preferably by a female. Good doctor-patient relationship. Establish good rapport with the patient. Help seeking second opinion from senior professional where necessary. Immunization should be done whenever necessary, particularly for tetanus. Inform the patients of any intended absence from practice or recommend or make available a qualified substitute. Junior assistant should be selected with due care and caution and should be employed while entrusting duties to them. Knowledge about technical advances and standard procedure of treatment should be frequently updated through periodical journal CME conferences. Leave no patient unattended during labor or under anesthesia. Make no statement constituting or admitting fault on your part. Never guarantee a cure. Never abandon patient. Operate only if absolutely necessary in a criminal wounding. Proper instructions should be given to the patient and proper post-operative care should be taken. Prescription should not be dictated over telephone because of possibility of misunderstanding as to drugs or their dosage. Qualified anesthetic should be employed, and only generally accepted anesthetic should be given after clinical and lab examination of patient. Refer patient to higher center if facilities are inadequate to handle his problem. Sensitivity test should be done before injecting preparation, which are likely to produce anaphylactic shock. Treat, test both laboratory and radiological to confirm diagnosis. Undertake no procedure beyond one's skill. Verify, check frequently conditions of equipment and available safety installation. Write a full, accurate and legible medical record. X-ray in cases of bone or joint injuries or in doubtful cases. Next is defenses. No duty to patient. Discharged his duties in accordance with the prevailing standard of medical practice. Damage caused is not due to negligence but should be due to act of any other person who was also concerned with his treatment. Novus actus intervenus. Damage was a result of a third party that interfered in treatment without his knowledge or consent. Failure of patient to follow his advice properly or failure to give proper history contribute to negligence. Damage complained of is an expected outcome for particular type of disease the patient suffered from. Damage resulting due to taking some unavoidable risk in good faith and interest of patient with his or her guardian consent. Damage caused by a specific line of treatment used on persistent insistence by patient in spite of the doctor's warning about the risk involved in that method of treatment. Reasonable error judgment. Therapeutic or diagnostic disadvantage. Medical malaccurrence. Complaint already been tried once by a doctor of law, res judicata. Completely lodged 2 years after occurrence of a damage. Res indicator period of limitations. Significance. Criminal negligence is more serious than civil negligence, practically limited to access where patients die. A doctor may be liable for both civil and negligence by single act. For example, if a doctor performs an unauthorized operation on a patient, he may be sued in civil court for damages and prosecuted in criminal court in assault. This defenses is no duty to patient, discharged his duty in accordance with the prevailing standard of medical practice. Damage caused due to negligence but should be due to any act of any other person who was concerned with his treatment. Novus actus intervenus. Damage was a result of third party that interfered in treatment without his knowledge or consent. Failure of patient to follow his advice properly. Damaged complaint of his an unexpected outcome for a particular disease that this patient suffered from. Damage resulting due to take some unavoidable risk in good faith, interest of patient with his guardian's consent. Damage caused by a specific line of treatment used on persistent insistence by patient in spite of the doctor's warning. Medical malaccurrence. Thank you.